Hi everybody, and welcome to the Recovery Channel. In this short section today, I want to talk about alcoholism. Is it a disease or is it a choice? And I really want to get to the bottom of this question, because if it's a disease, we should treat it. If it's a choice, we simply need to get alcoholics to make better choices. Well, I know it's a disease, and if you've been watching some of these sections, you know that too. But I want to settle the question once and for all. How do we know that alcoholism is a disease? Well, we know it because there's defined pathology. And if you've been watching, you've seen pictures of the brain, you've seen neurochemistry, and you know that there are biological reasons why people are alcoholics. There are well-recognized symptoms, just like many other diseases. There is a natural history of the disease, early, middle, and late stage symptoms. The most important reason that we know it's a disease is because it responds to treatment. Medications can improve the outcomes, and there's some really new and exciting medical treatments that are available for the disease of alcoholism that we'll be talking about in a subsequent section. It does not, however, respond to punishment. Unlike all diseases, alcoholism responds to medical treatment, not law enforcement and punishment. What is effective treatment for alcoholism? Abstinence from all mood-altering substances. This allows the brain time to heal and recover. Another component of effective treatment is education about the disease of alcoholism, and medication, as I mentioned earlier, if it's indicated, can be very helpful for these patients. It is a disease. It's not a moral failure. It's not due to ignorance, poverty, low socioeconomic status, lack of education. It's not primarily a psychiatric or personality problem, but it's a biopsychosocial disorder that is based in the brain and results in symptoms. And that's how we know it's a disease. We compared alcoholism to other chronic and progressive illnesses, and there are similar success rates and relapse rates to diabetes, hypertension, and asthma. The results of alcoholism treatment are similar in outcome to other chronic and progressive diseases. And that's another reason to remember that this is a disease. It's not just bad choices. So, what would it be like if we treated diabetics like we treat alcoholics? And this is an important thing to think about, because if we really believe that alcoholism is a disease, and I do, then this is what it would be like if we treated other diseases like we currently treat alcoholics. Well, we'll treat your disease for 28 days. Oh, you're going to have to be on your own after that for your blood sugar management. We will not treat your diabetes until it's in the late stages and you're in a coma, or your finger's fallen off, or you have some ulcer that won't heal. If you show up in my office with an elevated blood sugar, I'm going to fire you as a patient, you'll lose your job, and I'm going to send you off to jail. And I won't screen you for your diabetes, because maybe, just maybe, I eat more candy than you do and have more blood sugar problems. Well, this is all ridiculous. Of course it is. But we know that alcoholism is a disease and it responds to treatment. My goal here is to educate people so that we can push for the disease of alcoholism to be treated just like any other chronic and progressive illness. It will result in an enormous savings to our economy and a tremendous benefit to the health of this nation. Thanks for listening.